Thank you very much, Mr. President. Some words about medico-legal responsibility in France. Until the beginning of the 19th siècle, the surgeon is no responsibility to the justice of men in France. He is responsibility only to his conscience and to good. Neither his failures, much less his successes, can be attributed to the surgeon, but to the divine will. We see history, responsibility levels, and so on. So, the first civil code, the man who commits a fault causing damage must repair it. Creation of Royal Academy of Medicine, whose members are considered as experts. 1832, first trial against a surgeon. 1897, creation of the first association to defend the physician, which is the first medical insurance company. 1936, the relationships between the physician and his patients becomes a contractual relationship, requiring the physician to give conscientious care and consistent with the data acquired from medical science. 1992, explosion of number of laparoscopic procedure and explosion of lawsuit of trials of complaints. 97 reinforced obligation to inform patient of surgical risk, and the Kushner law, patient rights and health democracy, the medical file related to the patient, and there is compensation for no-fault complications by national solidarity. Creation of conciliation and compensation board for medical accident, iatrogenic disease and nosocomial infection, and obligation for physicians to be insured under penalty very high. The beginning of the laparoscopic procedure and the beginning of the complaints and the beginning of our association with Club Méditerranéen de Chirurgie Endoscopique, we give the Medi. First medical insurance company. Responsibility levels: financial compensation, disciplinary responsibility, and criminal responsibility were involved in case of trial for involuntary homicide. Different types of complaints: oral or written request, direct amical transaction, claim for compensation by letter, complaint to the Council of Order, criminal complaint less than 10%. The majority of cases lead to an expertise. What is expertise? A magistrate appoints an expert or a panel of experts to whom he asks a number of questions. The expert must answer this question, which allows the judge to know if the surgeon acted according to scientific society recommendation, code and ethic, and humanism. An expert is a physician who has performed 2 or 3 years of medical law studies after at least 5 years of practice. These studies are sanctioned by a diploma of medical expertise. The medical expertise, the expert summons the patient and the surgeon, checks both as the same file. Each can be assisted by a lawyer and a physician. The expert examines the patient, analyzes the practice, evaluates the damage, and says if he thinks there is a causal link between them. He sends a pre-rapport who gives his opinion about car's quality and the level of damage. This pre-report is sent to the judge, the patient, and the surgeon. Everyone can answer. It's a dire à l'expert. Expert's answer can be used by the judge to say if there has been medical fault or complication without fault, medical accident or therapeutic error, and to say if there is a certain direct and exclusive relationship between the fault and the damage. What fault? Lack of information, indication fault, technical fault, defect of follow-up, too late or inappropriate management of the complication. The surgeon is condemned if existence of the fault established, existence of the damage established, relationship between fault and damage established. Surgical complication can occur without fault if the complication has been handled early and correctly. Since 2002, a financial compensation takes place from a certain threshold of severity through a National Compensation Office for Medical Accident. Retrospective analysis of 10,000 complaints. Bariatric surgery, neurosurgery, orthopedics, obstetric. Level of financial indemnity increases everywhere. You can see some indemnity levels. We have about 3 million euros for some indemnity. Complication by electrosurgery can be imputed in solidum at surgeon and hospital. We have studied a claim in bariatric surgery. The claims reported to the 3 major medical insurance companies in France with 46 days. Surgeon every time prosecuted and sometimes hospital and anesthesiologist. Procedure engaged conciliation or tribunal. That is the type of intervention for some colleagues who are good bariatric surgeons. A fault was asserted in a quarter of the case. The fault was technical fault, indication fault, lack of information, delayed diagnosis of the complication, delayed prescription, delay of transfer, delay in communication. Delayed diagnostic, why? Because falsely reassuring imagery which misses the diagnostic. We have said that yesterday evening with a beautiful communication of a colleague. Delay of transfer, because sometimes no visit during the weekend, surgeon no reach the surgeon on call does not practice bariatric surgery, and so on. Too early exit, no exit visit, insufficient exit visit, and so on, all are the faults. Judgment. 69 files, financial compensation of important damage by National Office for Indemnisation, without fault. 66 files, no financial compensation, no fault, and low damage. But 63 files, financial compensation of the damage by the surgeon through their medical insurance company. And we have now a judgment to this year, compensation to be provided like 2 million euros, and the file is not closed. Information, some recommendation after that. Information, fin for the patient, the clear language, dispels the illusion, take more into account the psychological aspect. Recommendation, during the first consultation, give statistic, morbidity, mortality, information, explains that the treatment of a fistula is very important, necessitates changement of team, and so on. The patient must seen successive documents. He has been informed. He gives his informed consent to the proposed therapeutic strategy. He is committed to a long-term follow-up. In the immediate follow-up, privilege the clinical approach. React quickly. In laparoscopic surgery, we said every time, second look, quickly second look if we have tachycardia. Very important, the exit visit made by the surgeon who performed the procedure. In case of complication, offering to the patient and his family all his time, all his empathy in a humanist relationship. Remember that many claims come from many surgeons. And remember this publication, medical error is the third leading cause of death in United States after disease, heart, and cancer. And what tomorrow? The answer is teaching the risk prevention, risk complication risk, trial risk, condemnation risk. And as many colleagues from many countries, members of MESA, told about their roses, the trial in their country, the lack of training of experts, judges, and lawyers. And because risk prevention associations were already created in many countries, I thought that ethical and medico-legal committee of our MESA had its role to play. And I propose you this project. Dedicate a MESA committee for risk prevention, propose a federation of national associations to awake our colleagues to the medico-legal reality, ignored by all, no teaching object anywhere, to build national and international teams for risk prevention and for defense of the surgeon. Why? To defend the honor of our wonderful profession and to allow people to approach this profession, younger people, without excessive anxiety. Thank you for your attention.